This is the fitting procedure for the Bledsoe Thruster Unloader knee brace. The first thing I like to mention is that when the brace comes out of the box, it will have two different types of pads that can go on the number one strap, the strap which is directly below the calf. It has a rubbery faced pad that's more grippy, it doesn't slide on the skin, and then it has a soft velvety pad. I typically like to go with the rubbery pad. And then you have two options in addition to that. You have this metallic piece of aluminum with Velcro on both sides, or you can go with a piece of double-sided Velcro. The thought behind this is that it will distribute the force through a larger area to be more comfortable. In reality, some people say that that's too stiff and it hurts, and so I usually go without that. I usually take this off and use the double-sided Velcro that's included to put on there, and then put the strap in place. The first thing you want to do is, of course, position the brace on the leg. Knee should be flexed. The easiest thing to do is find the medial epicondyle and palpate the epicondyle, and that will be the point of reference for the hinge as it sits down over the medial aspect of the knee. I like to look at the contours of the shell first. If it's a custom-made brace, it should come out of the box pretty much ready to go without any shaping or contouring. If it's an off-the-shelf, you may have to do a little bit of bending. Just make sure that it looks like it's not too much pressure right on the tibial crest. You can, with your hands, bend this down to curve it a little bit so it matches the natural contour of the tibia if needed. So I'd start by positioning the hinge and then bring the number one strap around behind the knee. And this number one strap should be high, almost in the crease of the popliteal fossa. It should be relatively high and relatively snug. When you attach this first strap, you may have to loosen this up and buckle it, and then you can cinch it down accordingly. A quick little demonstration is I like to lift the brace up before I've done any other straps and try pushing it down the leg and just see how it resists migration. If you can push this thing right down easily, you don't have this strap tight enough. So that's a good little test to do. The number two strap is on the very bottom. Just bring it around, engage the buckles, and again push until it clicks into place. You know it's clicked and is secure. Number three, bring it around. Of course, I've pre-adjusted these straps, but you may have to release the strap initially to get it to clip in, and then you can pull it down to tighten it up. Number four on the top, push it until it clicks. Now the hinge is adjusted by pushing in on the dial and rotating the hinge away from you. If it's a medial, you rotate away. As you stand, as you go into extension, you see the hinge starts to pull away from the knee. This is a medial unloader, and so this is a patient who typically would have a varus condition with a bad medial compartment, and so they need a valgus-producing brace, and that's what this brace does. As you go into extension, as you're weight-bearing, it's a valgus-producing brace to open up that medial condyle and produce some separation and take some of the pressure off. The amount of adjustment is this. I always prefer to do too little than too much, and I would say start off with about 20 or 25% of the total available adjustment. Have the patient stand up, walk around, see how it feels. It may or may not feel better immediately. If it doesn't feel better immediately, I use the simple analogy. If you hit your thumb with the hammer every day for a week, and on the following Monday you stop hitting your thumb will still hurt on Monday, and it'll still hurt on Tuesday, but by Wednesday it'll be less painful, and by Thursday it'll be feeling even better. Same thing applies with this. As they are weight-bearing daily, grinding those surfaces in the knee is irritated, it's inflamed. The knee may actually still hurt quite a bit when they even produce the unloading. So it may take a week to 3 weeks to really tell the difference. For some people it's dramatic. For some people it's instant relief. far as the dial though, I would turn it up slowly until they feel like it's unloading. There's a little bit of pressure there. When in doubt, always undercorrect, not overcorrect. The joint of the brace is always located on the same side as the affected compartment. Thus, a medial compartment will always have a medial hinge. Likewise, a lateral compartment will always have a lateral hinge. And I think that's it.